And welcome to our COVID-19 and Beyond webinar with the big support of SonoScape. And it's really a great pleasure that you're all with us here on board. And I'm Helmut Neumann from Germany, and for us it's now 2 p.m. And we have also very distinguished guests today, fantastic speakers from all parts of the world. And
I'm Zanding from Wuhan Hospital. Today is my pleasure to get the invitation from the SonoScape Medical. The key points to avoid the risk of second wave infection is to manage the new imported person and to test and to find on time.
So what we need to do, like the Chinese endoscopies, is to continue in a rigid infection and prevention control strategy. We should not relax only because now we read 0 on our newspaper.
And so the question is now, how do we restart? How do we safely reopen and come back to business as usual, which it will never be business as usual?
We should always have our protection protocols in place, because even if the numbers go down, even if the numbers become 0, I think this will never end pretty soon. This will drag on for a long time.
And the figure which we found, we did a questionnaire with 375 people responded, 375 endoscopists of the country. And the figure was, as we discussed, that around 10% of the endoscopies were being done.
You try to come up with some stratification of your patients, and what we have done is 4 priority.
In COVID, you can do only 1 endoscopy because we have limited capacity and a lot of things to do. So if you do 1 endoscopy, please do it well. And to do it well is not on you as endoscopist, but it's on all the organization, and it is also on the technology and the equipment. For this reason, if I scope 1 patient, then I review after 10 years, I want to do with high definition, speed preparation, use of advanced imaging. You know, I like SFI.
So the centers which are depending on people coming from outside are going to have a problem. And I think it's, as we discussed, it's not so far as the resources are concerned, whether we are ready or not, but it's the fear of the patient and the logistic problem which is going to decide the volume, at least in our setup.
It will never be normal anyway, so let's always be protected, always.
We know from our understanding that it doesn't remain on the surface, the virus doesn't remain on the surface for too long. So if you use the mask after 4 or 5 days, the mask possibly is already decontaminated.
It's a balance between the availability of PPE and availability of testing.
And we have over 280 participants, and we're receiving a lot of questions.
Add to the advice of government, we have to screen all the patients in our hospital. So it means we have the low risk of infection by the COVID-19 in the procedure.
You go into a parking area, which is for these patients who have just gotten tested, and in 45 minutes you get a phone call whether you're positive or negative.
So I think we should combine our tests with just clinical acumen, just looking at the patient.
We test all patients for the procedure. So even the patients have the history of the COVID-19 infection, but if the nucleic acid and the IgM antibody are both negative, so we don't consider the patient as infection.
Actually do cycling of our staff, in which only the minimum, the bare minimum of staff come in, and they work for a whole week, and then they do shifts so that they will not be exposed too much.
I mean, if you do a good disinfection, this virus is not a problem.
American Society for Gastrointestinal Endoscopy, or the ASGE, has come up with guidance statements on how to safely open endoscopy. And I think a lot of the things which are in the guidance statements is what we have been discussing today.
And also, I think because it's now time for us to end this webinar, it's very important for us that this was only the first in a big row. So SonoScape is planning many more to come with specific questions and with specific topics with experts from all parts of the world.